Welcome, everyone. I'm glad you could join tonight. This is something that we've been working on. The University of Maryland School of Public Health, Dr. Sacoby Wilson and his team have been working on a research project, and this involves nitrates and how it could possibly affect various things, especially dealing with education and public health. With that, I'm going to throw it over to Dr. Wilson and allow him to introduce his team. And there will be a question and answer segment at the end. So please save all your questions for them, and welcome, Dr. Wilson.
Yeah, thank you, Maria. So happy to be here tonight with my team. We have Joe and John. They are both central members of the team who help with this project. And so what we want to do is give a little bit of background on the project, talk about the data, our methods and results, go into discussion, conclusion, recommendations, have some discussion on limitations as well. And then, as Maria said, open it up for questions. So I'm gonna pass it over to Joe. Joe, if you want to give a little bit more background on yourself, you can before we get started.
Sure. Yes. My name is Joe Gularraga. I graduated in the spring with my MPH in Health Equity, Master's of Public Health and Health Equity. I studied under Dr. Wilson. Started working for the lab in the spring, and this was sort of the first one of the larger projects that I helped with and took on. So I will now begin the presentation. John is also here, and John has conducted the majority of the analysis, all of the spatial analysis, and some of the statistical analysis was performed by another member of our team, Abraham, who's not here tonight. But we're going to go through and explain everything. So I'm going to bring up our presentation, and here we go. We'll get started. So what this study aimed to look at was the proximity to concentrate. Yes?
Joe, my screen is blank. I'm not sure. Can everybody else see it yet? Or is it just me?
I can see it, but I'm not sure.
Oh. Okay. Oh, go ahead. I got it. Go ahead, Joe.
Oh, okay. So the name of the project, the research, was proximity to concentrated animal feeding operations, nitrates, and the association with special education enrollment and proficiency in Delaware. And below are all of the authors involved and researchers with the project. So to get started, just going to do a little background regarding agriculture, manure, agricultural byproducts, nitrogen, things like that. So to sort of give the scope of this whole issue, global food demand is said to increase by 59 to 98% between 2005 and 2050. And agricultural production is inevitably going to have to rise to meet that demand. We have such a large global population, growing global population, lots of inputs necessary to keep agriculture up to pace with the demand for food. And so some of those inputs include synthetic and manure fertilizers. They improve soil productivity and therefore increase food availability. But fertilizers contain nitrogen and other nutrients that can cause things like destructive algae blooms and have harmful health impacts when they are overused, used in a way that's not controlled. And agriculture accounts for 85% of the total anthropogenic nitrogen released into the environment. So through agricultural production, we see such a large amount of nitrogen entering the land use, water use, things like that. So concentrated animal feeding operations produce high quantities of manure. And manure is one of these inputs that we see with regards to fertilizer, and it's high in nitrogen. Runoff from feedlots is a cause, excuse the typo there, runoff from feedlots is a cause of nitrate groundwater contamination. And then manure that's sprayed as fertilizer has the potential to go beyond farm boundaries in addition to becoming this runoff. So we're going to now talk a bit about CAFOs and pollution, byproducts, associated contaminants, things like that. So CAFOs are animal feeding operations with more than 1,000 animals that either discharge pollutants directly into U.S. waters or discharge pollutants into navigable waters through a man-made ditch. So that is really the defining characteristic, is that there are a lot of animals and that discharge basically is straight into a water system. And some of the associated byproducts, chemicals with CAFOs that have been studied by a number of researchers, including Dr. Wilson, and for various different animals as well, include ammonia, carbon dioxide, methane, nitrous dioxide, sulfur dioxide, arsenic, semi-volatile organic compounds, bacteria, and particulate matter. And particulate matter is important because that affects air quality. In addition to, you might think that when you see lots of dust particles or things like that in the air surrounding these operations, that doesn't seem as harmful as something like ammonia, but really particulate matter is a major indicator of air quality. And I'm sure that you all are pretty well familiar with the scope of Delaware's poultry industry, but in Delaware, large poultry farms account for 75.5% of the state's income from agricultural commodities, and that's higher than that of any other state. And it's the nation's 8th largest producer of poultry products. And obviously, you can look at this kind of broiler belt map that we see, and you can see Delaware being, very small over here on the East Coast. Yet it's, such a large producer, which just goes to show the concentration of animals, the concentration of CAFOs that are located throughout the state. And that's what this bullet down here is speaking to, the fact that, in 2017, there was one poultry CAFO per 4 square miles in Delaware, each containing on average almost 90,000 chickens. So we have a high concentration for a pretty small landmass here. And now we're going to talk about more of sort of the roots of contamination, how this happens through CAFOs, through agriculture, and what that looks like across the state of Delaware. EPA estimates that Delaware has by far the highest concentration of groundwater nitrate compared to any other state, and that's at 53%. So that estimate shows that over half the land mass has groundwater concentrations or nitrate concentrations in the groundwater that's higher than what is recommended, which is 5 milligrams per milliliter of water. So this is the standard that was set by the EPA, and ultimately it's sort of I guess how to say this. It's not exactly sure how much actual nitrate concentration will cause some of the ill effects that we can see from nitrates. So elevated amounts of nitrates can have adverse effects on human health, but are especially harmful to infants and also to mothers as well. So one of the most common things that we associate in terms of health with nitrates is blue baby syndrome, where a lack of oxygen at birth is associated with damaging the hippocampus, part of your brain, causing cognitive memory and learning impairment, which can lead to depression, stress, cerebral palsy, autism, and ADHD. And complications that mothers might experience could be spontaneous abortion, fetal deaths, premature birth, intrauterine growth retardation, low birth weight, congenital malformations, and neonatal death. So it's really, nitrate is really harmful to development is kind of the takeaway here. So this kind of brings us to our research question about nitrate exposure with relation to the poultry industry in Delaware. So we see that Delaware ranks 8th out of 49 states in the percentage of students ages 6 to 21 with disabilities, and 6th out of 46 for percentage of students ages 3 to 5 with developmental delay. So maybe trying to connect this nitrate poisoning, blue baby syndrome. The primary question of our research was to explore the possible connections between drinking well water proximity to agricultural operations, including CAFOs, the local nitrate concentrations in groundwater, and the association with special education program enrollment, math proficiency, and English proficiency throughout the state of Delaware using geographic information systems technology, using basically some advanced mapping techniques and spatial analysis in combination also with some statistical analysis, which Jonathan will touch on. And then our secondary question, which is more in line with or consistent with the work that the lab does, is the question, are CAFOs and their associated pollutants an environmental justice concern throughout the state of Delaware? And that gets us to the question, what is environmental justice? So we talk about environmental justice in the lab as when people are able to reach their full potential without experiencing isms. And this is a definition coined by Dr. Bunyan Bryan. And the isms refer to racism, classism, sexism, anything that basically prohibits the person from reaching their highest potential through, a barrier through society. And so this includes having people that are supported by decent paying and safe jobs, quality schools and recreation, decent housing, adequate health care, personal empowerment, decision-making, communities that are safe, that are free from violence, drugs, and poverty. So this is what we're wondering is, are disabilities or farming operations, industrial farming operations, are these concerns that would have implications towards environmental injustice? Are there people, are there communities, are there populations that are disproportionately feeling the effects of disabilities as a result of farming, or just farming in general, this industrial farming? So now I'm going to hand it over to Jonathan to discuss some of the methods that we used.
All right. Yeah, thank you. So when conducting the analyses, both spatial and non-spatial, we used a series of analyses, such as a CAFO host and buffer analysis, where a CAFO host would essentially be defined as any census tract which contained a CAFO. And then we also based it on these buffers, so areas around CAFO hosts or census tracts around CAFO hosts, which were within 2 kilometers and 5 kilometers of these CAFO hosts. And the reason why we chose these distances is 2 kilometers is generally the average commutes for school children going to school, and 5 kilometers is generally a good boundary for like polluting sort of spread or spread. And then we further also categorize these by risk, such as high risk, medium risk, and low risk, where high risk would be anything within or under 1 kilometer distance from a CAFO. Medium risk is 1 to 2 kilometers from a CAFO, and low risk is under 5 kilometers from a CAFO. And anything beyond that 5 kilometers is now not at risk, or in our determination. And then We used the Kruskal-Wallis tests and multiple linear regressions to try find statistically significant relationships between percentage disability and our chosen socio-demographic variables, including ordinary least squares regression, which is more of a spatial analysis to see any spatial trends and statistical relationships between these things. Next slide. Thanks. So this first one is the based on the disabled students in at-risk areas, so within those previously stated distances. And as we can see, the proportion of students who are considered disabled increases generally as you get into more at-risk areas. Although it isn't a clear increase in the proportion of disability, it is the highest in the medium and high risk areas. And some of these results, for example, with the manure in low risk areas, are strange in that it says there's zero manure. And that isn't due to a lack of CAFOs, but rather due to a lack of manure data reporting from the CAFOs. But we can get into that more later. But generally, as you'd expect, manure would increase as the number of CAFOs increase. And yeah, next slide. Here, we've conducted these prevalence ratios just to determine the prevalence of disabled students by census tracts when comparing certain census tracts which meet these criteria. For example, our reference census tracts would be any census tracts whose percentage of population living below poverty is under 15%, and the percentage people of color is below 30%. And as we can see, as in the bottom right of the table here, as the census tracts with larger percentages of people of color and living below poverty, the prevalence of these disabled students tends to increase. Yeah, next slide. And here we also conducted, based on the EPA's safe, I believe it's groundwater designations, the 5 milligrams a liter, using the nitrates data. And so any census tracts which was designated as a CAFA host or non-CAFA host, which was within 5 kilometers of a CAFA host, were then splits. And generally, there were, it's the data coming out of this is sometimes separated by whether something is urban or not urban, because sometimes, especially in high urban areas, there are greater people of color. However, generally, CAFOs don't always tend to be located in, well, metropolitan areas, essentially. So sometimes the data from this can be skewed due to the presence of the northern county, essentially, which has a large urban area. And also that the non-applicable percentage in the greater than 5 milligrams a liter, that's due to either a combination of school data being redacted or generally a lack of presence of schools in these areas as well. So I guess next slide, please. Here we can kind of see this distribution I had mentioned previously, where most of the CAFOs within Delaware are primarily located in the southwestern portion of the states, whereas due to most of the urban areas being in the north, that's also where a lot of the schools are. So the greatest overlap of CAFOs and schools is in this town to the south, or in the southwest of the Delaware, where there is a lot of overlap of CAFOs and schools. So that area could potentially be an area of special interest in future studies. Thank you. And here we've also mapped out the quintiles of different socio-demographic variables, so we can kind of see how these populations splits. And yet again, we can also kind of see it splitting along this urban-rural divide, as great proportions of people of color are in this urban area up north. However, in that town area to the southwest, there is an increased percentage of people of color, which is why it could be a special case to look at. But generally, the greater levels of below poverty and lower median household income are in these southern rural areas where CAFOs primarily are. Next slide. And here we are looking at schools which have been categorized by the risk. So they're, yet again, the distance from CAFOs. And the highest risk schools are in that southwestern portion of Delaware, where there is that great overlap of CAFOs and schools. And as we saw in the previous map, there were, and in this map too, there is a higher proportions of people of color in these areas of the high-risk schools. However, yet again, the schools at negligible risk are in the north, mostly due to the lack of CAFOs in these urban areas. Next slide, please. Thanks. Here, we decided to look at the analysis from a different perspective, rather looking at the watersheds rather than census tracts. And this is because we believed a watershed analysis might be a better indication of what would actually be affected by contaminated groundwater. So here we've mapped out the percentage of disability per watershed. So this is essentially an aggregate of the, or no, not aggregates, sorry, well, a percentage, sort of average of the percentage disability of students in each school in the watershed. So areas with 0% disability are generally areas where there aren't any schools. However, we can see that the percentage of disability isn't always fully correlated with the higher levels of average nitrates, but that is also because of other reasons, such as schools or students not always going to the closest school, like the nearest school to them, but we'll address that in limitations. Next slide, please. And what we found from the statistical results is in the Kruskal-Wallis-Duns test is that populations in poverty tended to have a statistically significant difference when looking at between like well hosts and non-well host census tracts. So I probably should have mentioned that portion before in the previous, on one of the previous maps, but active water wells were looked at as a factor in this, seeing if the nitrates or CAFOs would affect areas with larger amounts of wells. But in areas of poverty, there was generally that difference in areas which had wells and had or did not have wells. And there was also a statistically significant difference between the Delaware states, host and non-host populations of children living below poverty. And this is CAFO hosts. Then in the OLS tests, there were no significant results found. And this is for many reasons, such as some schools having redacted data, so that'd be essentially well, you can tell some of the scores or how many students with percentage disability in these areas. And also because it takes into the spatial portion of it, the urban area to the north were partially skewing the data due to the small size and how numerous the census tracts in that area were. But in the multiple linear regression, it was found that the DISA alternative tests and the smarter balance tests, or at least the proficiency in these English tests, were related to percentage POC, below poverty, and also children living below poverty, as there was a statistically significant relationships with the SAT scores. And this is also found as well with a with reductions in proficiency with poverty as well in sorry, I think that's meant to say I think that's one was SAT in English. Must have forgot to write that part down. Next slide.
Okay, so we're going to keep going over some of the results. So the ordinary least square regression at the watershed level, that map that we showed with the various size circles for percent disability, well, the results of that regression showed that the number of wells and watersheds was somewhat correlated with higher proportions of disabled students in schools, but it had a very small effect size. So it's basically negligible. It was still statistically relevant, but considering how much of an alteration it had, it doesn't really explain the high amounts of the number of wells doesn't do a great job of explaining the high proportions of disabled students across Delaware. But I think one of the most significant things that came from this analysis was that risk category analysis. I'm going to go back and talk about this one right here. So we see that basically, schools with some level of risk featured more than 4 times the total percentage of disabled students than those schools labeled as having negligible risk. So all of the schools that we saw that had no risk, that were sort of up away from a lot of the agricultural production, chicken production in southern parts of the state, the risk really increases based on proximity to CAFOs. So I think that is certainly notable. Also, the prevalence ratios. This is more of an environmental justice concern than a concern regarding the presence or correlations between agriculture and disabilities. But disabilities in Delaware are disproportionately present amongst populations that are below poverty and in communities of color. So just showing that these communities have a greater percentage of people who are affected by disabilities. And the statistical analysis shows that low wealth communities host more CAFOs than their wealthier counterparts. So going back to these results here, if these risk categories, we're basically saying that low wealth communities are hosting more CAFOs and then have a higher risk. And we have noticed that the proportion of disabilities is related to these risk categories, as mentioned in the second bullet point here. And this is consistent with prior work in Delaware that has been conducted by previous members of our lab with regards to the proposed chicken processing plant in Millsboro, that found that the poultry industry has the potential to disproportionately burden environmental justice communities within the state. So we're going to kind of talk about some of the limitations. So John?
Yeah. So one of the prime data sets we were using in this was the Delaware or the school data sets related to Delaware. And many of these schools had redacted data sets in this regard, which wouldn't always give us proficiency scores or students with disabilities in every aspect. So some schools had to be removed, so it wasn't a full representation of all the schools in Delaware, and some were simply like not counted in the some of the data due to the zeros that they would add due to the redactions. They had to be removed as well. So with more education data and or less redacted, it could be a more accurate analysis in that regard. Additionally, disability data was also not separated, but well, it's for obvious reasons, but it did make the analysis slightly harder because physical and mental disabilities were combined. So there's no way to tell the difference between students with a learning disability from one with, say, I don't know, a broken arm sort of thing. And this kind of came into, I don't know, this did sometimes mess with the data, which also messed with the spatial analysis to some extent, where you would find schools for the blind or schools for the deaf, which would have an 100% disability rating, which would sometimes skew these results. Additionally, school choice is not limited by census tracts. For example, in these like schools for the blind, you might actually, if you live, I don't know, further away, a parents might make that choice to send their students to a more specialized school. So it's not always indicative of where people are living and who's affected by like long-term sort of pollution and things like that. Um, Additionally, these census tracts are sort of human-created boundaries rather than a geographic boundary, which is also why we try to implement the watershed analysis into it. But it doesn't essentially account for where pollution might go. So a watershed might span like 4 different census tracts. And if we're just doing it by census tracts, and it could completely miss some of these or what would be affected by pollution, sort of thing. Next slide.
Okay. All right. So to that point, I think that what Jonathan's saying is that partially we were limited by our study design in this assessment, and that is to say that, like Jonathan was saying, people can travel across different areas to go to different schools. So we're looking at well water. It's an ecological study. We're not actually measuring exactly precise exposure. What we're measuring is, concentrations of nitrates that are modeled data. We're measuring proximity to CAFOs. We're measuring, school proximity to CAFOs, things like that. But that doesn't actually truly get to the exposure that children might be experiencing with regards to nitrates and other contaminants that are related, contaminants and pollutants that are related to, big agriculture, animal agriculture. So some ways that we might be able to do this in the future, and it involves, better data collection and better data stewardship, is to actually look at what exposure people are having. This can be done through sampling of private wells. There should be sampling of wells to see the amount of nitrate that people are actually consuming, and then looking at that, and then once again, maybe basing the amount of disabilities that we see in a school per the actual nitrate concentrations that people are exposed to. Other ways to do this would be through a survey where people report their nitrate concentrations in their wells, because as opposed to going through and taking an actual biological sample, you can do sort of like a survey sampling questionnaire, talk about people's exposures to farming operations, how close they are, etc., as opposed to just kind of doing this ecological modeling where we're looking at a map, looking at distances, stuff like that. And another way that we could do this would be, to follow, various cohorts, people who are drinking from private wells, people versus people who are drinking from public water systems, and seeing the differences there. There's also there's the potential incorrect data reporting for CAFOs. So one of the things that Jonathan was talking about was that there was CAFOs that were listed with no manure production. So this is a data limitation there as well. If we're not getting the correct reported data, then it's going to skew the results of our study. Oh, and then once again, talking about another data limitation is that the nitrate data that we use in our analysis is from the USGS. It's a model,
Guava.
the guava, right? It's the USGS guava model of nitrate contamination. So this is not based on a sample where somebody's going out into somebody's backyard and taking a core sample and measuring nitrate from the groundwater or from a well or anything like that. This is modeled based on a number of different factors and inputs that was done by the USGS. So it's all of the nitrate concentration data is based on that and not an actual measurement. So that's another limitation here. And there's a certain amount of data that we also weren't able to access just because it didn't exist at the level that would be useful to our study. So chemical data, stuff regarding pesticides and herbicides, other things that might have some sort of bearing on childhood development, they were not available except at the county level. And considering there's only 3 counties in Delaware, that's not really useful. You can't make very broad comparisons just between 3 counties. You really need that data at a lower level, at least census tract or watershed level, so you can really see how pesticides being used across the state in more discrete packages are really having effects potentially on childhood development as reported through the proficiency tests and special education enrollment. And then the other point to that is that beyond just different agricultural data that we could have used, there's just other relevant data that were not considered for this analysis that also could have bearing on childhood development. So like, we see in these maps, I'll go back a little bit, that there's so many schools up here by Wilmington, in the north. And then on this watershed map, we'll see that up there, there's also high concentrations of disabilities in the same area, right? So there might not be, I went a little too far there. There might not be agricultural contaminants that are affecting development, childhood development there, but there's other sorts of contaminants that might be affecting development, including toxic release inventory facilities, using national air toxics assessment data, air pollution information, understanding the other things that are potentially children are being exposed to that could affect their development and affect their proficiency, and perhaps whether they're going to need some sort of special education programs at their school, different curriculum, so that they can get the education that they need. So based on all of the different analysis, our limitations, our review of the literature, everything that we kind of came out of this study with, we have some conclusions and some recommendations that we would like to share with you. I think it's very important that Delaware holds this place within the chicken industry. It's an agricultural leader in terms of production, but because of that, it has to contend with the fact that it has all of these different agricultural byproducts and high contamination rates, as we would discuss with regards to the fact that 53% of Delaware's groundwater has some sort of nitrate contamination as estimated by USDA. So I think one of the other things that we talked about was the need for further investigation regarding agricultural production and its connection to childhood disabilities and poor performance in schools. So we can achieve that through better data collection. As we saw in our limitations, essentially, we weren't able to do the type of study that I think would have really gotten to the heart of this issue, because we had to rely on an ecological study, measuring distances, proximity. But if we really have this kind of data on, nitrate contamination in wells, that we could see, the DENREC and other state bodies really should make it a priority to collect this data in order to understand why Delaware ranks so high in the proportion of disabled students compared to other states. So we need to test drinking well water for nitrates and other contaminants, and this information should be made publicly available so that people such as yourselves and researchers like us are able to really look at this information and perform analysis on it, use it for different advocacy purposes, etc. Another conclusion is that sort of a corollary to our main question was that the agricultural industry really does differentially affect low wealth communities and people of color, and therefore is unfortunately in accordance with the legacy of environmental injustice. And so efforts need to be made specifically to protect vulnerable populations from the ill effects of this industry, including further regulation and enforcement of agricultural regulation, and kind of curtailing of harmful agricultural practices, making sure that there are enough stopgaps in place so that people aren't being exposed unnecessarily to these sorts of contaminants and pollutants that, as we've seen, can have really harmful effects on human health. And impoverished communities, low wealth communities, and communities of color have higher prevalence of children with disabilities. So this is a question that we should ask: is why are these communities disproportionately affected? What are the exposures here? What are causing these problems within Delaware? And there needs to be an expanded amount of resources that go to these communities with high prevalences of children with disabilities, including appropriate education and healthcare services, so that everybody has an opportunity to learn and be healthy. As in line with environmental justice, that definition, everybody should have the opportunity to reach their highest potential and not experience these isms as we talk about. So it's really should be a priority within Delaware to basically uncover more and dig deeper to the root of this issue. And that is the end of our presentation, and we would be happy to answer any questions that you all may have with regards to this project.
Hi, this is Keith Steck. I have some observations and some questions. The first question I have, is this the first time this kind of study has been done in Delaware?
I
Dr.
think
Wilson.
Dr. Wilson's muted.
That unmute button, man. You gotta hit the mute button. Yeah, I think this is one of the first studies. I don't know if it's the only study that's been done, but looking at schools, looking at wells, looking at nitrates, and bringing an environmental justice angle, I think it's one of the first with that combination.
Okay. Has something similar like this been done in other states? This kind of study?
Well, specifically as it pertains to looking at the distribution of animal operations themselves, yes, and disparities, yes. With hog farms in North Carolina and Iowa, cattle feedlots in other states. As it relates to nitrates, I believe some of that's been done in Iowa by some of the folks at the University of Iowa School of Public Health. And I believe one of my mentors, Dr. Wing, not on the nitrates per se, but looking at contaminants like ammonia and hydrogen sulfide, some more on air quality, and also looking at pathogens. Some work on pathogens that's been done in North Carolina. And then one of my former students, who's now a assistant professor in Maryland, Rihanna Murray, she looked at wells in pathogens. So looking at proximity of wells to agricultural operations in Maryland and campylobacteriosis and salmonellosis, but not bringing in the disability angle. No.
Okay. This is, to me, this is really interesting, and the maps really are telling, because when you look at the census tracts and you look at some of the other issues, some of the limitations that you guys described, for example, the issue of, well, I was going to ask this question, so I was glad that Joe mentioned it. Were there any issues with the CAFO reporting data? And it clearly looks like there is. And it raises a question why, not something you guys can answer necessarily, but it seems like that's a problem, not having accurate information to work with, both reporting of the CAFOs, and then also, I know that DNREC falls down on data collection on a lot of issues. So when you go back to those maps and you look at the census tracts and you look at some of the other, the concentration of people with disabilities, kids with disabilities in these different areas like the Newcastle County, there's no CAFO that I could see identified in Newcastle County, but clearly the areas where the high disabilities are along the roughly approximate where heavy industrialization takes place, heavy transportation, the highways are. So it begs the question, what about air quality, the impact? And you guys said that those were some of the limitations you had to deal with, not knowing the toxic release inventory levels and air pollution in particular, but also begs a question about water pollution, because I don't believe there's many drinking wells in Newcastle County, but there certainly are in Sussex County. That's all we have essentially, whether they're individual wells or whatnot. But then going back to those maps, it also seems like the concentration on the southwest part of the county, in Sussex County, you've got Bridgeville, Seaford, Laurel, and Bethel down there where there's high concentrations of CAFOs, high concentrations of water, I think those were the watersheds you identified, and a whole host of things. So,
and one quick point to add to what you're saying, one of the things that we were struggling with too, we wanted to talk about farming practices, right? So Joe, you can chime in on this, not just the animal feeding operations, but large farms where you're growing crops where you've been using a lot of fertilizer.
Right.
And we had problems getting the data. Go ahead, Joe, chime in on that part.
Yeah, so right. So basically, there's through the USDA, there's certain data sets that you can download publicly, and as I mentioned before, some of the stuff regarding pesticides and herbicides were only available at the county level. And then treated agricultural land, the definition of which is slightly opaque. That was not fully available. The amount of fertilizer applied, it just wasn't granular enough of data. So, and in order for us to really, try to make any connection between the amount of fertilizer and the amount of nitrate and the amount of disability. It's like we really need to have accurate data and granular enough data so you can really make those sorts of correlations beyond just something broad.
And one other observation. One other observation I have about that is you guys mentioned that you were using estimates, nitrate estimates, I think you said, from EPA or wherever the source was, because
Correct.
you don't have the drinking water test results. Has anybody done any kind of comparison of test results, actual drinking water test results? Because I know the state does collect that data from private wells when people get water sample tests. I think they report if they find nitrates, if they had their own private testing, I think they can report it. But obviously, the state doesn't test individual wells. That's up to the individual. So
right, and that's, I think, one of the things that we were hoping, yes, it's up to you to test your own individual well, right? But then you have people who are maybe not, testing with enough regularity and stuff like that. But I think that a better reporting on that, I think, is one of the things that we were hoping would, and more regular testing of wells, I think is I mean, obviously a very big recommendation that we have.
Let me get to Shelley. Go ahead, Shelley.
Hi. So 3 things. I think around here in the past, when they've talked about nitrate levels, they talk about 10 parts per liter, 10 milligrams, or whatever the measurement is. And they make that like that's the current EPA standard. And that's what we've heard over and over and over again. And it seems like you have, I guess, another reference from the EPA where it's half of that, which I know that one of the people that used to participate in our groups, John Austin, who's passed away, said it really should be 3 or less. But here, everything that they do and plan for, they plan around this 10 as the top value. But when they go to spray here locally in the unincorporated Milton area, they're actually spraying wastewater that can contain up to 30 milligrams per liter. I might have the measurements wrong. So I just wanted to, it's sort of like, it's interesting that all these decision makers are using this other parameter for the spraying of wastewater and waste on land. Then the other thing in Sussex County, they instead of having, I don't think it's consistent, but their way of treating waste in general is land application. And they're increasing this. This is their thing. And not only are they applying human waste and animal waste on land as a way of disposal, but they're also importing it from other states. So it's increasing. I mean, I don't even know what the value would be. And the third thing I just wanted to point out is, I think there's one school that's set aside, the currently operating school, and I forget the name of it, where it's for disabled students. But they've built another school that I think would be operational as soon as they allow kids to go back to school. So whatever the county statistics are for disabilities, physical or mental, for students, they must have data that they haven't shared with you, because they've built another whole school to accommodate all these kids in the county, and it's a big school. So and I think I had a conversation with somebody I know who had foster children, and she said the ones with disabilities in the past were all bused to one school, no matter where they lived in the county. So I'm just throwing that stuff out there.
No, thank you. Just want to speak to your first point. You're speaking to the fact that whether it be lead or particulate matter or nitrates, there's really no safe level. I mean, what's a safe level of nitrates? So the fact that we're showing a threshold of 5, it could be you could be chronically exposed to below 5 and had neurological, defects, right? neurological effects. But this 10 it's more of a political decision. I don't think that 10 is actually based on science and epidemiologic studies and looking at surveillance and looking at the health outcomes to inform appropriate policy. That's more political, maybe risk assessment decision. But if you take into account, as we were saying, some other underlying factors, right, then you're not protecting the most vulnerable person if you have, in my opinion, a threshold of 10.
Right, but that's what they've been using.
Right. That's what we have as, I was just looking up the Guava database, what we used, and what they're saying is that the EPA has it set at 10 as their standard. Nitrate concentrations in natural groundwaters are usually less than 2 is what they're saying. So I think that by us using 5, it was to show a difference between the EPA standard and then also to show that there was there was human activity that was contributing to it, because less than 2 is where you can sort of see, okay, this is as quote unquote natural as it gets, but 5 definitely indicates human activity at that point.
I believe in the EPA site for the estimated nitrates concentrations, they also use the 5 milligrams a liter. So that was we had based it off of that because they were also using the Guava data at the time to do their estimates.
Mm-hmm.
And I appreciate your additional point that you talked about. So it's just not agricultural practices, of application of fertilizer. Is the application of the chicken manure on land application, just like what they do with spray fields in North Carolina with hog waste, right? But then you're bringing in, you said human sludge from sewage treatment plants, or chicken manure from other states? Is it chicken manure and human sludge, both?
I'm not positive. I think that's probably more human. I'm not 100% positive, but there's a lot of the applications with DNREC have been for land application of, they use the term biosolids, which I think
it's a euphemism. It's a euphemism.
But it seems to vary quite a bit. I mean, you hear that, it's like it could be anywhere from like just sludge to, whatever variable levels of treatment. But this seems to be the theme here. Instead of building true waste treatment plants, wastewater treatment plants, it's land application, or the glorified lagoon,
the crap pit, right? We call it, you guys, I don't want to say the other word, I want to be professional, but the crap pits. Yes.
Right, and there's more and more of that all over the place.
Yeah, so I think you hit on an important point. So Dr. Wing, my mentor I mentioned early on, before he passed away, he was doing work on biosolid application. And I actually would put that in the bin of an EJ issue, because you talk about unincorporated, right? A lot of places that are targeted for these activities are those that are unincorporated. Why? Because they don't have political, it's like contamination without representation. You don't have political representation. And so that's something we had to look at, is this is different than this discussion, but looking at areas that are unincorporated and see if they're disproportionately impacted by some of these facilities, the chicken farms, and also the sludge application. Because anyway, so we need a policy change to protect unincorporated communities.
Right, and I think by doing that, they're kind of blurring the lines for responsibility, potential lawsuits when they throw everything into the same pot and spray it on a bunch of land.
Yeah.
And then, and then of course, they have the crops that, when I first heard about this, when I first moved here, they said, oh, that's not for human consumption, it's to feed the animals. And locally here, that would be the chickens. Yeah. And that's probably primarily true. But I do think some of that food that's grown is for direct human consumption. Plus, let's face it, it's people who are eating the chickens, Yeah,
so. And then you got the runoff too. So if you got anybody who's fishing, any recreational activities, they're going to be exposed to those biological and chemical contaminants in that mix, that mixture of animal and human waste that have been applied to those lands.
Right. Yeah, for people into crabbing, I think there's certain areas where they're saying you shouldn't consume the crabs from those
Yep.
creeks. It's I don't really know the proper term for it, but like we're
Are they tidal? They're not tidal creeks, sorry. That's not what it was.
I don't know, maybe Maria might understand that better than I do, but it's like I know there's some places where people still do it, but they shouldn't be consuming what comes out of there.
Okay, thank you.
Thank you.
Okay, so I know that there's both Maria and Marie have had hands raised. So whoever would like to go next.
First.
Can't hear you.
You're muted,
What?
Maria.
Marie, let Marie go first so that she
Oh,
gets her
okay.
question, because I can always.
Go ahead, Marie. All right, Maria, are you muted too?
Yes.
Okay, Marie, it looks like you're unmuted now.
Go ahead, Marie. Did we lose Marie? She's still there.
She's still here. I can't, still can't hear her.
No, the microphone might just not be working on their end.
Okay.
Or her
Well,
volume.
we can come back. We can come back to you, Marie. Go ahead, Maria.
Okay. So first, a couple observations and then a couple questions. First, not surprised that the data is not available. This is something that we are consistently running into in Delaware, and it's a real problem. You know, there needs to be transparency, and especially during a time now where we're talking about issues that we've talked about for decades now, right? But there is a big spotlight shining on these issues.
Okay.
So we've been talking about them for, 20 years. Now it's time to do something about it. And if we don't have the data, then we're not going to be able to address the issues. So I think, and I don't know if that can be done legislatively. What do we need to do to get this data? We're number one in a lot of things in our states. Unfortunately, it's always something that's bad, right? So we were number one in nitrate pollution in groundwater at all the states. Is that right? That was correct?
That's, yes,
Yeah.
yes.
God almighty. And then, so this, I found that this is problematic as well. When you were talking about the different disabilities, how they are not classifying them by like developmental, or if it's a physical disability, how can we actually even know the extent of the problem, right? If we don't have this data, because when you're dealing with things, this will go to another question that I have, or a comment. If we don't have this data, firstly, how can we even figure out where the problem is and what's causing it, right?
Exactly.
Secondly, it's well noting, and I think Keith brought it up and you guys brought it up, that in the north, we have a lot of industrial pollution, and that's all falling in the EJ communities and transferring out into various educational problems, right? In the southern part of the state where we are with the agricultural, industrial agriculture, we're having a lot of these problems, especially it was pointed out in math and English proficiency and math in the SATs. So we really don't know the extent if we don't have the correct data. But I would like to know, is there a study that we can do like within a community where there are high levels, right? Like a small community where we can do water, and how about air? Because I have, the feeling that air would have a lot to do with this too. And then on that note, Shelley had brought up about, sludge we're getting, they're bringing in sludge now from Chicago, from the biggest waste treatment plant in Chicago. Synagro, they're just talking about bringing Synagro, just had a public hearing. Anything they want to dump, this state, they make it a dumping ground. And it's really, it's insulting. It is, it's insulting. We need things that are going to keep kids here, things that are going to bring economic development that invites a positive growth in the community, bringing in schools, colleges, things that are going to be a place where we want to live and be proud of and have living wage jobs.
They're important poison, basically.
Right.
Well, and that's, yeah.
Whoops, sorry. So on that note, we started talking about the truck traffic, up north. Well, now they're going to we have 2 different biogas manure to energy facilities coming in, both in Sussex County, one in Seaford and the other one in Georgetown. The Seaford one, I just read on the application, they're talking about 82 trips per day. So that's 164, and that's on the application. I have a feeling it'll grow beyond that. God knows the other one. So these are something that has to be fed, 24/7, 7 days a week.
Right.
Aren't we just magnifying an already bad situation?
Yeah, let me chime in on the last part. So I think there's some policy options that we got to develop the policy options, right? But let me say a couple things. So one of the things I think will be useful for your state is for y'all to have your own environmental justice screening tool, your own state level mapping tool. So we develop, you know about US EPA EJ screen. We're developing the Maryland EJ screen tool. So North Carolina is actually developing its own tool, and in some ways it's similar to your state because it has a lot of agriculture, in the eastern part of North Carolina. And that'll be a way to look at arid communities that may have concerns with environmental issues and basically targeting additional ordinances and buffers and zoning changes at the local level. I think the issue with the waste is you have interstate commerce. So you got the commerce clause. So the same way you got human waste being shipped here, you got coal ash being shipped to places, other parts of the country from, or you got solid waste being shipped from New York and New Jersey down south, right? And so we got to figure a way to work around the commerce clause. Getting to your question about poultry, I do believe that Senator Cory Booker had tried to push out a CAFO-related bill in the last year. So trying to get some type of national bill on CAFOs that get at these issues that we're talking about would be important too. And then sorry, going back to the truck traffic. In Maryland in 2016, we tried to get a bill passed called the Reduce Act, reducing environmental degradation in underserved communities through engagement. I named the acronym. And so the idea was to try to deal with truck traffic around industrial facilities. So that may be something to look at. It's a failed bill, but it may be something to look at. Also trying to do some type of ordinances related to the island, et cetera. And then y'all, to be honest, we gotta be pushing for states to say all trucks have to be electrified. Electrification is one way to deal with the exhaust issues from diesel. Because diesel particulates irritate eyes, nose, and throat, impact your coordination, concentration, focus, and also diesel particulates contain 40 contaminants that can cause cancer. Okay, but electrification is one solution too. So I just want to say that real quickly. In some ways to get at some of the issues associated with both the poultry and also the truck traffic.
And Maria, I think that to your point about how do we get this data, I think that one of the things that would be good to look at. This is a bill that's currently in progress, or it's under first review now in the state of Maryland, and it's called the Healthy Community Air Act, and that is a bill that basically ensures. Oh, you know about it. Okay.
Yeah, she knows about it.
All right.
Tell everybody else about it.
Okay, I'll tell everybody else about it. All right, thanks, Maria. So it basically ensures consistent data reporting on air quality throughout Maryland, particularly on the Eastern Shore, which is your neighbors there. So and that is the sort of bill that I think you can use as a model, and perhaps you can use that as a model to further get at some of these issues. You know, how do we basically mandate that we need regular data collection and regular data reporting so that we can answer these kind of questions that we have? So I think that is something to try to develop a similar bill around the issues and around the data that you all need, which I believe would be around, you know, nitrate concentration, regular sampling. Yeah, there is the issue about private versus public well kind of thing, but, you know, figuring those sorts of things out. And I mean, if you can, you know, get sampling of public wells, that's better than nothing, because you could still use that as proxies when you have people who live close. I mean, everybody has their own treatment thing, but still, it's as a better measure of what data you can get than what we're using now, which is these estimates from this, you know, groundwater maps. So that's a recommendation that I have.
And then
Other
Hello.
questions? Oh, that's go
Hello.
ahead. Yeah, go ahead.
Yeah, Ken Haynes. How you doing?
Hey,
I'd
go
like
ahead.
to thank you, Doctor, for the survey that you came in. You had a couple women, few years ago that came into Possum Point, Millsboro, and did a survey,
Yeah.
so we could move forward. But like you were saying, well, Jonathan was saying that they can't get data out of Sussex County, but they didn't even want your data when we had it.
Yeah.
I mean, it's like we're hitting a stone wall anywhere we go. And well, to go back to a phrase you just said, that you weren't going to say it because you're a professional. Well, I'm not professional. Yes,
Yes,
Sussex County is a real shit pit.
Yeah.
Now, my other question did involve what Shelley went through with the 10 milliliters.
Mm-hmm.
I mean, yeah, the late great John, he was saying 5, but I noticed that was a date from 2005 from the EPA, according to your maps or your listings.
You mean the
It's good.
go ahead, John. Joe,
Sorry.
were those estimates from the model? Were those 2005 estimates?
They're 2007, the Guava estimates. That's kind of what they use. They haven't created an updated model from there. But yeah,
Okay.
that's a limitation. Yeah.
Yeah.
Okay.
So,
I also noticed on your watershed map, and you also had the disabilities on that map. I noticed the area that I'm living in is under the dark pink, which looks like it is no man's land. So I'm wondering, okay, down here, the majority of everybody are on private wells. In your show that you just put on, you were pointing out toward Newcastle County, which majority of that has town or city water. So I guess my question is, why did that show so many disabilities with the schools up there compared to what we have while we're in the dark pink of the no man's land down here?
yeah, Joe. Go ahead.
Oh, sorry. I was going to say,
Go ahead, Jonathan.
that's also partially to do with the fact that they don't always, students aren't always just going to the school closest to them, because this percentage disability data is taken from the schools themselves. So it's not it's not a reading of like everyone in the census tract, like who has a disability. It's just for school children. So in some cases, there were, I don't know, schools for the blind or for learning disabilities outside of these areas with very high average nitrate levels, which can account for some of these things. Yeah.
That's some of it too. And then also we were saying that there's other factors that might play into that, like, you know, in the areas around Wilmington or Dover, you know, places where there might be more or different kinds of pollution as well, different air pollution. So that's why we were saying that another study that, or future studies that should be done should try to include other sorts of pollutants beyond just, you know, nitrate. Maybe we could use air quality data. There's the NATA cancer risk data.
And it also includes, NATA also includes neurological risk data too.
Yeah, okay.
They have an estimate for neurological risk. Go ahead, keep going, Joe.
Yeah, right. And then also other data that toxic release inventory. So other toxicants that could have neurological effects as well. So just because you see the dark pink down there in Sussex, and you're saying, well, you know, what's the difference between what's going on up there? It's because there's things that we might not have accounted for when we were only looking at nitrates that could explain the high levels of disability in those areas as well.
So just to add to that real quick, and Maria, you can chime in on this. We are having a new conversation about doing a Delmarva sort of research partnership. And I have a colleague who's a mentee of Dr. Steve Wing. And the reason I keep mentioning Dr. Wing, he was one of the world's most renowned researchers on animal operations, particularly hog farms, before he passed away. And so Chris has been doing some work, some long-term work with some of our community partners in North Carolina. And so our plan is to try in the Delmarva is to do some citizen science-based air quality monitoring using low-cost sensors to measure particulate matter, but also to get at ammonium hydrogen sulfide. There's not a lot of readily available low-cost sensors for ammonium hydrogen sulfide, but we do have colleagues at Hopkins who I believe can build some sensors for us so we can get near real-time data on those pollutants. In addition, we want to be able to the tracers, genetic tracers for bacteria that are in the gut of chickens, and be able to take dust samples from your home, take water samples from your wells, take soil samples from your gardens to see if we see those chicken markers. That means if you got chicken poop gut bacteria in your house, that came from a local chicken farm, okay? So that's what we want to do. And then he's done some work looking at MRSA in both livestock workers and folks who live near hog farms in North Carolina. We want to adapt that method for the Delmarva. And he also has developed a salivary-based SARS-CoV-2 COVID-19 test. So we talked about for those essential workers, are folks who are working in the meat packing facilities, our livestock workers, trying to work with them to get them access to some quick testing that allow them to know if they've been exposed and the privacy so they can figure out what they want to do. Also, it'll get at your immunity, so it can capture your immunity levels too. So we're having these emerging discussions, but this is work we're going to move forward to hopefully start filling some of these gaps. And so we're in Maryland, in Delaware, and also in Virginia. So I just wanted to say that.
All right. Great.
Ahead,
Thank you.
Okay. Thank you.
Yep.
Am I on?
Yeah, go ahead.
Okay.
Yep.
So some of you may have gotten an email from me the other day about that. So that's what this is. It was explained a little bit, but I think Dr. Wilson explained it more. This is really exciting. Anybody that did not get involved or that did not get an email, please get in touch with me if you'd like to be part of it, because we really want to, if we're doing this, we want to do it right. We want to have community participation. And what is most important to Dr. Wilson and to me is that the people that are in these communities impacted are the ones at the table, and it's their
Exactly.
voice, right?
Exactly.
So we
That's
don't
right.
want, you know, people that are, you know, thinking they're brighter than the best of us. We want the people in the communities. They know best, right? You guys
Exactly.
live this every single day. So it's really important that your voice is heard. I wanted to just add something really quick because I see she's on here. Maddie Gloria is, she did a toxic release inventory between her and I can't remember your partner's name, Maddie, that did it for the News Journal because the data was not accessible. You know, so we were very grateful that Maddie and the News Journal, Delaware Online, put this together for the citizenry here because we don't have access to this data and we should. So that's a shout out, you know, that we're glad to have that kind of community support when it comes to things of concern, that the media is concerned that we don't have access to it.
Any other questions?
Yeah, I have one, well, two. One is this in a report? Do you guys have a report on this, and is this available online, or how do we get access to it?
We can, Maria has it?
Yes, so I just got it probably maybe like an hour, I think, before this. So I didn't get a chance to send it out, although I did send Maddie a quick copy because I wanted her to hear this. But yes, this report. So this will go out. I will send it. I'm actually going to send it to the entire email list because we have an electronic copy, and that will go out as soon as we're done tonight, Keith. It's all in a PDF for you, okay?
And one quick thing for you, Maria, one idea. I'm really want us to make sure we get this out. So maybe even doing a little press release that kind of gets at, I mean, so the things that we thought we were going to find, we didn't find them. But what you did here is we need transparent data. We need better data. We need more accessible data. We need to have transparent practices, like where's this waste coming from? I mean, and why is it going to all the incorporated areas? Why do we have these disabilities? Why is not the data split up with the physical, you know, and the learning disabilities? That's kind of what it is saying, to push GenRec and other state agencies, data transparency and holding them accountable. So putting this in a press release and saying, we need to have the health department, GenRec, do more work, and then we need to have our folks in the state house get off their butts, for those who are on their butts, and do something. So you have an opportunity, I think, use a press release to kind of push some points.
Yeah, and I think we're going to record this, Sacoby, and we'll have this out there to go out so that people who could not watch it can have, you know, at their own convenience, can watch it. And we will send it out with the press release as well.
For what you've done, and you know, it's as valuable for pointing out the flaws and the problems as the research results have been, as far as I'm concerned.
Thank you.
Thanks.
Thank you very much for your hard work.
Yeah.
You're welcome. And we're really, really committed to working again to get better, getting the science into the hands of the people, getting y'all the tools, and doing community-driven research to cover air, water, and like I said, like if you got the genetics, that genetic marker, why is that poop in my house? That's powerful.
Right.
And so we want to be able to get you the information you need to change policy. So the government is not going to do the science. Unfortunately, community folks are not going to do the science. But as partners, we make sure you get the best scientific tools. Okay.
Anyone else questions?
How fast can you do the air thing? I just went out to catch a smoke, and wow. The processing plant across the river from me is letting out something.
So we can. It's going to take a little bit of time. But one thing I want to add to what I didn't say. There's also an app called Smell My City Pittsburgh. And so another part we can do is train residents to do their own odor ratings. And then you can map those odor ratings. And then we have the sensor data. So think about how your sensor data can track with your odor ratings. So I didn't want to forget that. That's another piece of what we want to do. So we're going to do a lot of community training. So you learn how to use the air pollution sensors. You can learn how to take the samples that we need to send to the laboratory to look at the markers of chicken bacteria poop. And then there's these other things too. So that's going to be a part of it. So it's almost like five components. The air, the water, the COVID, the odor, and these genetic markers.
All right. Thank you.
You're welcome.
So do we have any questions before we let Dr. Sacoby eat dinner and all of his teammates? I can't thank you guys enough for doing this. Honestly, our communities here are very, very, very grateful. As I'm sure, I know Dr. Sacoby Wilson, you know this. We don't have too many willing partners down here from our state, unfortunately, who want to do this kind of research. And this is really exciting to me. This big project that we're getting ready to do, I can't tell you how excited I am. And I want full court participation. I mean, this is big. This is an opportunity. So I thank you for having us be part of it. And for everyone else. Anyone have any last questions before we let Dr. Wilson go?
Cool.
I guess
Just
we're
to
good.
say how grateful, we are for his attention to this matter. We do, I think we're a very neglected area, so this is really wonderful that you're, doing this scientific study and taking it further. Thank you.
No, you're welcome. That's part of my mission as a researcher, to do science for the people and science that's about action and change. So glad to help.
So Joseph, Jonathan, Dr. Wilson, thank you again. We really appreciate all of your work into this, all the graphs, the whole report. It's very powerful, and we just really appreciate it. So I'm going to let you guys go. Thank you everyone for attending. This was all sponsored by SRAC and Sussex Health and Environmental Network. And stay tuned because we're going to be doing a lot of research. This will go online and we'll send out the reports to everyone. And have a lovely evening.
Thank you.